baby. From 3WL 1350, sports, food, and fun, it's Talk Gumbo with John Spud McConnell. If you want to add some spice to the conversation, call 504-260-6368 or toll free 855-395-6368. Now, time for 3WL's Kingfish, the Spudster, one hot potato, John Spud McConnell.
Hey, way in, baby! How y'all making? Hour number 2 on the Spud Show, 3WL 1350 AM. Give me a call. Tell me what you think. Right now, just for a few minutes, I had asked this gentleman to visit us today. Keith LeBlanc is the CEO of MHM Urgent Care, and that's, you know what those places are. But there's a thing tomorrow about diabetes, and he's going to tell us more about it. What's up there? What you say there, Keith? How's it going?
Hey, Spud, how are you?
I'm fine. I got diabetes, though, and I know I'm going to be going to see my endocrinologist next month, and she's going to give me all kinds of grief because I'm not doing what I'm supposed to. So, what can I say?
We understand.
Well, you understand, but I don't know, man. My wife fusses at me, but I guess she didn't fuss loud enough. I shouldn't be saying that. She's listening, so I'm sure I'll be getting fussed at even more tonight. But what you guys are doing tomorrow is like, is this like Diabetes Awareness Month, or what are y'all doing?
Right. So tomorrow's Alert Day, which is like the Breast Cancer Awareness Day,
Mm-hmm.
and it's designed to call attention to diabetes, but with a focus on type 2. You know, type 2 diabetes is the what's historically called the insulin resistance. You produce insulin, but your body can't use it, so your sugar builds up. It is most commonly, controlled with exercise, diet, and those type of things, or some medication. It's about 90% of the people who have diabetes have type 2, and a bunch, and I don't know the exact statistic, but a fair number of them don't know they have it.
Yeah, it's the silent killer, like blood pressure. The thing of it is, though, diabetes affects all of that stuff.
It absolutely does. Your eyes, your heart, all the other thing, gout and the things that go with diabetes. So I think you remember, Spud, my dad had diabetes. It complicated his heart disease. It shortened his life. So we made a commitment here at MHM as a give back is to try to start a program about access and awareness and diagnosis. So we're starting a program that we're going to run for 30 days and then see what happens, and I suspect we're going to extend it thereafter, where a patient can come in and get a free screen. If they test normal, great. They spent 15 minutes of their life. The screen takes about 3 minutes. Now, of course, there's a little bit of paperwork you got to fill out.
Yeah.
There is no fee. So if you test normal, you go away knowing you're normal. If you test in the risk range, then through the Diabetes Association, you're going to be contacted on a monthly basis for a period of time, giving you all the information and access to information to tell you about your disease and what lifestyle changes you need to make so that you don't end up with diabetes. I think the third category, somebody walks in and they actually have diabetes, then again, we're going to get them in contact with the Diabetes Association so those social workers follow up with them with lifestyle. But then we have a network of physicians in our provider network that we will actually hook them up with a physician for follow-up. So the focus is really about access to care. And as you know, we've got 11 locations in the greater New Orleans area, so most of our centers...
Y'all are basically my primary care physician. I don't know.
And unfortunately, we're like that for a lot of people. Now, look, our clinics do not treat the disease ongoing. That's not what we...
No, y'all are emergency. Y'all are like urgent. Your urgent cares is like you need a flu shot or you need to figure out what's going on or, it's not the place you go for a broken bone, but,
Yeah, and believe it or not, our acuity goes up. We fix a lot of broken bones. We stitch a lot of wounds. We debride a lot of abscesses. So, the interesting thing is the more clinics we get, the amount of patients we get continue to go up, and the acuity level continues to go up. But I want to be clear to the public, we don't treat diabetes on an ongoing basis.
That's an endocrinology thing, and you guys are urgent care. This is chronic care.
That is correct.
Yeah.
We do episodic care. We do not do chronic care. The whole mission and MHM support, and, again, we're giving away the test, so that's our contribution. It does not require an appointment. Patient can walk in any day at any center. The test itself, again, takes about 3 to 5 minutes. There is a little bit of paperwork. If in fact you test into the risk category or you test that you have diabetes, then of course we need to get your information to the Diabetes Association, and we need to give you a list of physicians that you can follow up with Our goal is to identify as many people as we can that are in that border line or have diabetes that don't know they have it and get them in care.
Well, and the thing about diabetes, too, is, it's not like you can go, to the drugstore, the Majorities, or the Walgreens. You sit down, they got those blood pressure cuffs where while you're waiting, you can get your blood pressure taken. Those things are 100% accurate, but they're better than nothing. But there's no place for you to go and get your finger pricked and get some blood and put it in a little machine to see what your blood level is. So this, it's like you said, a lot of people don't know they have it because there's no... Unless you go like downstairs a couple of months ago here at where we work, for the people who actually work in the building, the Oxnard people showed up. They took your blood pressure, they pricked your finger, they did a blood test on different things, and said that. But Joe Blow walking down the street doesn't have a place to go to test and see if he's got diabetes. So this is a pretty cool thing, which is why I called you up and said, come on and tell everybody about it, because they just don't have that many venues for you to go to find out if you have this disease that can ultimately kill you.
No, I agree. And look, we didn't have the machine either, so we had to purchase the machine before we could get in the program. And I think it's important for the patients to understand, look, this does not require you to be fasting. A hemoglobin A1C basically tells you what your average sugar level has been for the last 90 days. So the nice part about this test is if you go eat a piece of king cake, last thing you want to do is measure your sugar an hour later. This is irrelevant. You can eat a piece of king cake an hour before, and you do not have to be fasting. This is going to give you an average. Now, again, I think the other important part, this is a screen. So this is not at all intended to be the end-all, cure-all. This is to give you a screen of an average of what your sugar has been, tell you if you either have the disease or you're in the risk to have the disease, and then it's critically important that those patients that rank in those two categories go back, get in service or get with a chronic disease endocrinologist, internal medicine. And again, based upon our clinic location, we have a network of physicians that are geographically around each clinic location. So any patient that comes in, we're going to have a physician or a list of physicians that have agreed to participate in the program with us that we will send them to for follow-up care.
Now, I messed up and I'm on insulin, and I'm getting better. I'm keeping I have my spikes, but I'm steady working it down. But the fact is, Patty Cake over here, her husband just got tested, and they're going, you know what, if you lose 40 pounds, you're not going to have diabetes anymore. It's type 2 diabetes specifically. Nobody could possibly reach the age of, say, 30 and not know if they had type 1 diabetes, which is, tell the difference. What's the difference between two of them? Because type 1 you're born with, type 2 you get.
Yeah, and again, look, I'm not a physician, so I'll be careful. So in a nutshell, in type 1, your body does not produce insulin at all. In type 2, your body actually produces insulin, but you can't use it appropriately, or you don't produce enough. So I think you're right. Look, weight, exercise, diet all play in, and I don't have the statistics, and again, I'm not a physician.
I know.
Careful, but a large portion of patients with type 2 can actually control the disease with diet, exercise, and weight loss, which is the whole part about why we connect you to the Diabetes Association so that they can give you consistent information over a period of time. I believe it's for a 6-month period through the grant that we're participating in. So if you test in that group, the Diabetes Association is going to contact you and send you information on a consistent, repetitive basis to remind you, much like you tell me your wife reminds you, right? You're going to get actual information on lifestyle, diet, exercise.
No, I'm just going to get fussed at. But, everybody else, the American Diabetes Association, they're very, very competent, and pretty much all the information that they're going to feed you is free. They want you to be healthy. If you're smart, you can't do this completely without doctors' instructions and care. But once you get on the right path, you can manage it and maybe see them once a year or something like that.
Yeah, no, and I think, look, most people, again, what's our goal? Our goal is about access and identification and getting people in treatment. It's the silent killer because people are walking around out there and don't know they have it. So one of our goals this year is always to bring awareness and raise money and continue to do research, but is to identify people that are in that risk zone or have the disease that don't know they have it and then get them in care. So we think it's a great initiative, again, as a personal attachment to me, given that my dad had it and it shortened his life. You know me well enough, so I exercise regularly and try to eat right, so I'm not yet in the danger zone, but I have the genetic code to be in the danger zone.
Yeah. And a lot of people have it and don't know. You're also dealing with people that can develop this as young as 20 and as late as 60. You just don't know.
Yeah, I mean, the historical threshold, I think, is 45, but you're absolutely right. You have a couple of standard deviations, so anywhere from 25 to 60, I think, is probably an accurate range.
All right, so this is tomorrow, March the 25th, from 10 a.m. until 1 on Fulton Street over there by Harrah's.
That is correct. And there'll be a series of Millennium's going to have a booth there, so patients can sign up, they can get information, they can get learn where our centers are, or they can go to urgentcare.com or myhealthmatters.com. LSU is going to be out there. Tulane's going to be out there. A podiatrist is going to be out there. So I think in Fulton Plaza you're going to see 10 or 12 informational booths designed to give people as well as small businesses. A component of the fair tomorrow is about wellness for your employees. So you'll see businesses out there as well as individuals. The fair tomorrow is free. It's just a plethora of information for patients, and then we're going to run the program for 30 days and see where we are. I suspect, Spud, we could end up running it throughout the end of the year, but we're going to give it a 30-day trial to see where we are and then adjust, and then I'm fully confident we're going to run it for some period of time after that.
All right, so that's tomorrow at Fulton from 10 to 1. On Fulton Street by Harrah's on Tuesday. The American Diabetes Association, MHN, Urgent Care, and others, the healthcare community of sponsors, will be out there. And I tell you one thing, being able to test your blood without having to worry about fasting before is a big, big deal. Because everybody goes, oh, man, I already ate. Screw it. Or I just had a big old, I had a big Dunkin' Donut or something like that. I had some cake from the door next. I don't know.
Exactly.
But this way you can do it. Very cool. Keith, I appreciate it, man. Thanks a bunch.
But always a pleasure. Thank you.
All right, guys. Keith LeBlanc, the CEO of MHM Urgent Care. So this completely free tomorrow.
Yes, sir. Completely free.
On Fulton Street from 10 a.m. until 1 p.m. Cool. All right, man. Thanks a bunch. I got to step away. 260-6368 is the number. 855-395-6368. Or you can send a text at 95415. I have diabetes. I'll tell you one of the things that surprised me when we get back, and then we'll talk about this guy who lost 56 pounds eating Mickey D's. That's ought to be interesting, and that's what I've heard about diabetes, too. If you just lose enough weight. I've lost a ton, but I got about 6 tons to go. And, boy, the older you get, the harder it is to lose. All right, Spud Show here. Get a cup of coffee. We got to talk.